Tennis elbow, or otherwise known as lateral epicondylitis, is caused by an increased load to the tendons of your extensor muscles that are on the back of your forearm that attach to the outside of your elbow. So as you get more load to these tendons, over time they become injured and sometimes inflamed, and then you start to get pain on the outside of your elbow. In this video, I'm going to show you exactly what causes this kind of condition in the majority of cases, and then I'm going to go through how we can treat the problem and stick to the end to find out my top 2 exercises that you can do today in your home to fix the issue. Let's begin. Hello, my name is Dr. Stephen Hume. I'm a chiropractor currently based in Didcot, and this video I'm going to be talking about tennis elbow. So this is pain that goes to the outside of your elbow, and as I stated before, this is due to an increased load to the tendons of your extensor muscles. So what causes an increased load to tendons? The load of a tendon is going to increase through 3 main factors. The first factor is when that muscle is stretched, and that's going to cause the tendon to stretch. As you stretch the tendon, you increase the load to the tendon. The second thing is going to be deconditioned and weakened muscle. As you weaken the muscle to compensate for the strength, you have to increase the load to the tendon. And the third thing is a quickly stretched muscle. As you quickly stretch the muscle, you quickly stretch the tendon. And if you put the 3 together, the most common cause of a tennis elbow, funny enough, is playing tennis. What happens in tennis is as you make that swing, you go into a flex position. As you go into the flex position, you're going to stretch the extensors on your forearm that attach to the outside of your elbow, increasing the load. And so just in that one action, we're putting all 3 factors there that increase load to a tendon all in one movement. So tennis elbow is often caused by repetitive flexion exercises. If you suffer with tennis elbow, more often than not, you're going to get pain when you try to extend the wrist. This is because you're going to be using your extensor muscles, which puts pressure onto the tendons, so you're going to feel it the most when you try to do anything like that. Often will also get worse the more that you do those repetitive flexion exercises. So if you're playing a lot of tennis, often it will start to get worse the more that you play, and it will tend to get a bit better the more that you rest it. Now, to explain this further, I need to very quickly explain Sherrington's law. Now, please don't run away from this. It's a very simple term that just means as you flex a muscle, or as you contract one muscle, we have to extend or stretch the opposite or opposing muscle. So for example, as I contract my bicep, in order for me to get that elbow flexion, I have to extend, or I stretch the opposite muscle, which is your tricep. This occurs in pretty much every muscle in the body, and so they work together. So muscles work together in opposing fashions. This is the same with your elbow and your upper limb. Now, muscles don't tend to work in isolation, they work in groups of muscles. So for example, for your upper limb here, you're going to have your flexor muscles that all work together to do this action, and then you have your extensor muscles that all work together to do the extension action. Your flexion muscles are going to be your biceps, your wrist flexors, and your finger flexors to do this action. And then the extensor muscles are going to be the exact opposite. They're going to be your triceps, they're going to be your wrist and finger extensors. One of the most common findings that I see with people that suffer with a tennis elbow is an increased flexor tone in their upper limb. So basically what that means is they have more tone in their flexor muscles, so the biceps, wrist and finger flexors, in comparison to the extensors. Now, how do you know if you've got this? Very simple, your shoulder will tend to protract or come forwards more than your other side. That is a very strong indicator that you have more flexor tone in your upper limb. And I often will find this on the same side that you get the pain in the elbow. This is a problem because as you increase flexor tone, what you do is you stretch your extensor muscles, the opposite muscle, because remember, as we contract or shorten the biceps here, we stretch the triceps. That happens all the way down the arm. So as we get that increased flexion, we're going to get increased load on that tendon because we are lengthening that tendon. That was the first thing that causes increased load on a tendon. The second problem with the increased flexor tone is that you're also going to weaken the muscle. As you stretch the muscle, it tends to weaken. And if we weaken that muscle, that was the second thing that causes increased load on a tendon. If we couple this then with the quick action of a flexed motion like playing tennis, then that's going to be the triad of increasing the load on that tendon. Now, although that is the most common cause that I find of a tennis elbow, there are other things that can cause it. So things like a bony spur within the elbow. If that is the cause of the tennis elbow, then of course what I'm about to go through is probably not going to have much effect on you, and you're going to need to get that bony spur taken away. Now, a bony spur is quite rare to get. Most commonly, it's going to be from the mechanism that I just explained. And if it is due to the mechanism that I explained, I'm going to go through a few things that you can do at home to correct or at least alleviate this problem. The most effective way of treating this, however, is through a series of adjustments that can decrease the tone of these muscles. And so if you are suffering with a tennis elbow, that shoulder is protracted forwards, and I would strongly recommend to see a chiropractor, because that's going to be the best and quickest way of solving this issue. In the meantime, however, I'm going to go through 2 exercises and a piece of advice at the end that you can do to help the problem, and hopefully this will be enough to at least take away the pain or give you some relief. So the first exercise is going to be a stretch to those flexor muscles. So remember that the flexor muscles are come forwards here on the whole of the upper limb, and so we want to try and decrease that tone, and so we're going to want to try and stretch those flexor muscles by taking it into extension. As we start to decrease the tone of these flexor muscles, that will then start to shorten the extensor muscles, taking some of the load off that tendon. So the easiest way to do this is going to be to place the fingers on a wall or a doorway, and then making sure that the elbow extends and the shoulder is going to come backwards, and then you're going to push forward to stretch the front of your arm. As you do that, you should feel the stretch in your fingers, the front of your forearm, your biceps, and the front of your shoulder. Hold this for 30 seconds, repeat 3 times. You can do this every single day. Now that should help to decrease the tone of that muscle and therefore alleviating the pain. Now just make sure, like any of the exercises that I ever give, make sure it's not increasing the pain in that elbow. If it is, then it's probably not going to be a good exercise for you, and I would stay away from it. Or try to modify it in a way that it doesn't cause pain, because if you're provoking the pain, its likelihood is that you're going to be making it worse. Now the second exercise is going to be more specific to the elbow, and it's going to be just to stretch more the wrist flexors, finger flexors, and the bicep. And so we'll just be missing out the shoulder on this one, but it gives a bit more of a stretch to this area. So what you're going to do is place your hand on a table with the fingers pointing down, and then you're going to just extend that elbow, and you should start to feel quite an intense stretch over that elbow. You can then just flex that back and forth to create a dynamic stretch, just so extending it and then just bringing it out of extension slightly. Now again, this shouldn't cause any pain that you normally get. So the pain on the outside of the elbow, it's okay if it causes a bit of tension in the muscle or a stretch in the muscle. That's what we want to feel, but I don't want it to feel worse after you've done the exercise. Now the third thing I'm going to suggest is a brace, particularly at night. So particularly if you wake up in the morning and it's a little bit worse, then you might want to brace the arm, because what we tend to do in the night is that we tend to put our arm, or at least some people tend to put the arm in a flexed position and the wrist in a flexed position. If you're holding and sustaining this position in the night, that's just going to increase the tone of the flexor muscles, and it's certainly going to keep the extensor muscles stretched, which is going to stretch that tendon on the outside, provoking the problem. So if this is you, I would certainly think about bracing the elbow, and you can also brace the wrist into more of an extended position, or maybe not completely extended, but certainly away from that flex position, so fairly straight. You can also brace the wrist into a more neutral position, but the more important one would be the elbow. So they're the best exercises that I have for this, and the best piece of advice I have for this at the moment. As I say, we usually get very good results by treating this issue in the office. So if you're suffering with it, if you're anywhere near Didcot, feel free to come and see me. Otherwise, go see someone else that has some idea of how to treat this kind of thing. And usually it doesn't take too long to correct. So don't feel that you have to live with this condition. It is usually very treatable. It just needs to be diagnosed and then the correct treatment implemented. I hope this has been useful, at least finding out what causes it in most cases. If you are somebody that has that shoulder protracted and you have the pain on the outside of the elbow, likelihood is that this is one of the major causes of this issue for you. And so hopefully it's going to be helpful for you to get some relief. If you haven't subscribed to my channel yet, then please do. I provide videos on helping people to live pain-free. So yeah, if you haven't subscribed, then please do. And I'll see you on my next video. Thank you for watching. I'll see you next time. Bye-bye.